Hello, my name is Luis Castillo and I am the Marketing Coordinator at the University of Arizona's National Center for Interpretation, also known as NCI. This is a presentation about our customized medical interpreter training and assessment services that we offer at NCI. Some of the topics we're going to talk about are medical interpreting background, why, the ethical and legal considerations, how, the comprehensive interpreter training, a little bit about NCI, how NCI can help in customized medical interpreting training, a little bit about the costs, past and current clients, and learning more and further information. In the area of medical interpreting, usually underqualified people provide bilingual help at different healthcare settings. But is that meaningful help? Is it qualified, ethical, or legal? It is important to recognize that healthcare providers have ethical and legal responsibilities in the area of language access. Personnel need training and testing, and some of the examples that are needed in intensive training include routine care, skilled care, custodial issues, and mental health assessments. So why is medical interpreting training needed? There's ethical and legal considerations. For ethical, there's ethical responsibilities for setting the standards, providing meaningful access, and improving the language access for the patient's full understanding, participation, and consent. For the legal considerations, one must consider the federal regulations from Title VI of the Civil Rights Act of 1964, the Executive Order 13166, the Health and Human Services Class Standards, the Affordable Care Act's policy against excessive readmission, the Joint Commission's Comprehensive Accreditation Manual for Hospitals, and all of these are intended to help healthcare providers, hospitals, to avoid clinical errors which may lead to legal disputes. So how can medical interpreting training be done? Comprehensive interpreter training encompasses training with assessment. Some of the benefits of that include: it clarifies the role of the interpreter, it fosters meaningful access to healthcare, reduces error, allows doctor-patient communication and collaboration, assessment assures the healthcare provider that the knowledge, skills, and abilities are sufficiently present to ensure access, and the appropriate provision of language services ensure the compliance with regulations, equal access to care, reduces liability, reduces the length of stay for limited English patients, known as LEP, reduces health disparities, improves LEP patient compliance with care, and improves patient and provider satisfaction, among others. The University of Arizona's National Center for Interpretation, NCI, can help healthcare providers with medical interpreting training. So a little bit about NCI. NCI is a leader in the field of language services since 1983. NCI has pioneered the foundational interpreter training and certification instruments and processes universally accepted in the field of interpretation. NCI developed the Medical Interpreter Competency Examination, also known as the MICE. Since 1983, NCI has offered a 3-week Court Interpreter Training Institute, known as the CITI. Since 2003, NCI has offered the 2-week Medical Interpreter Training Institute, also known as the MIDI. NCI has trained over 400 healthcare providers. NCI, CITI, and MIDI have trained over 2,000 interpreters from 18 different countries. CITI and MIDI graduates achieve 40% improvement in their interpreting abilities. CITI graduates pass the FCICE at roughly double the national rate, and this stands for the Federal Court Interpreter Certification. MIDI graduates pass the MICE at roughly 2.5 times the average rate. We also provide professional web and document translation services that can help healthcare providers ensure language access among all patients. NCI offers customized medical interpreting training that can fit the needs of healthcare providers. The training can be done in 2 days, in 3 days, in 4 days, or even longer. The medical test, the MICE, is an option for any training session. The program includes flexible curriculum with established pedagogy, introductory lectures, analysis and critique in small group work, and actual interpreting practice through role-playing and or pre-recorded scripts and documents. We also provide instructor feedback, which may include grammar, vocabulary, and specialized terminology. There's a variety of areas that we provide training on. For example, the role of the medical interpreter, the interpreter ethics and protocol, cultural issues in medical interpreting, interpreting modes and techniques, concepts and terminology, skill development, which may include consecutive interpretation and sight and translation, major diseases and medical specializations with a focus of your choosing, such as diabetes, cardiology, oncology, gastroenterology, and pediatrics. We offer professional and competitive pricing. The base cost for training is $175 per day per participant. There's a minimum of 2 days training and 10 participants. And the final cost depends on a variety of factors, such as the provision of venue, location, number of participants, the length of training, special language needs, and the degree of development required for customization. In this slide, you can observe some of our past and current clients. And in addition, we have a testimonial from one of our current partners, Monica Frisbee, Language Services Manager from Tucson Medical Center in Tucson, Arizona. If you would like to learn more about NCI's customized medical interpreting training, please contact us today. Please contact Dr. Courtney Coffey, Workshop Tutoring and Testing Coordinator. Phone number 520-621-3615. We also provide here with some emails, our website, Facebook, and Twitter. Thank you very much for your attention, and we hope to hear from you soon.